Hello, welcome to this episode of Male Fertility Series. I'm Dr. Peter Chu. Well, usually if the couples are young and if they have regular sexual intercourse, say about 2 to 3 times a week, that's average. And usually it takes about 80% will get pregnant within the first year. And the second year, 90% will get pregnant. So that leaves about 10% after 2 years of marriage and still cannot get pregnant naturally. So, but there are other factors as well. So, for example, age. If you are married late and sometimes the sperm and the eggs may be not so good and it may take a longer time to get pregnant naturally. And lifestyles. People who are smoking, who are drinking a lot, and they can affect the sperm as well as the ovulations. So they may take time to get pregnant. And the other thing is stress, the work life stress and so on. And medical illnesses. If you are sick, of course, it can affect your reproductive health as well. If you are under 30 and you try for 1 year with regular sexual intercourse and still don't have babies, please go for a fertility check. If you are above 30 and try for 6 months without any results, please go for the check. When the couples come for fertility health check, besides history taking, physical examinations of the general systems as well as the reproductive system, we do some laboratory investigations. For the females, usually we'll do blood hormone tests if the menses are very irregular. Sometimes we usually do a vaginal scan, ultrasound pelvic scan, to find out whether there's any cysts in the ovaries or any fibroids in the uterus. So these may be causes for the female fertility. For the male, we always check for the sperm semen analysis. Semen analysis is important because male factors contribute about 50% of the fertility issues. And during the semen analysis, we check the quantity as well as the quality of the sperm. And the quality will involve, the motility as well as the shape of the sperm. These are all contributory to the fertilization of the egg. First, he should not be under stress, okay? It should be done under stress-free environment. Number 2, he has to abstain at least for 3 days. During the semen analysis, the test is done by masturbation. Majority of them agree with doing that, but some, because of religious belief or not used to masturbation, then they can use non-spermicidal condom, which has to be purchased specifically from the fertility lab. The ordinary condom contains spermicides and they'll kill all the sperm. The sample has to be sent to the lab within 1 hour after it is collected. Poor sperm qualities can affect the fertility in 2 ways. One, if the motility is not good, that means the sperm cannot swim very well, then of course it cannot fertilize the egg. If the shape of the sperm, that means the morphology of the sperm, is no good, then even if it is fertilized, the genetic materials may be abnormal and therefore may cause a lot of miscarriages. And miscarriages, 70 to 80% is due to genetic factors. And the sperm could be one of them. Studies have shown that if you take unsaturated fats, you take a lot of vitamins and more complex carbo and not so much simple carbo, okay, then the fertility impact will be positive. Now, lifestyle, the body weight can affect both the man as well as the woman. If the man is overweight, then it will affect the sperm quality and as well as the erection. For the females, if they are underweight or overweight, then that will affect the fertility because the ovulation will be dysfunctional. If you have late night, okay, those people who sleep late at night and they don't have enough rest, and if they are under a stressful environment, that can also affect their fertility. If you drink alcohol, smoke, then all these will affect the quality of the sperm as well as the egg, and therefore you have a negative impact on fertility. So sleep can affect the circadian rhythms in our brain. When we see light, we wake up. We see darkness, we sleep. Those people have done studies and found that those people with shift work, like nurses, they have fertility problems as well. That's because during sleep, you are repairing yourself. The cells are repairing. So that will affect the fertility. If your body is not healthy, of course you cannot get pregnant. Talking about exercise, there is no such thing as good or bad exercises. If your sperm semen analysis is normal, then there's no need to worry too much of exercise. But if your sperm quality is borderline or not so good, then intense exercise is not so healthy, especially if you do it episodically. That means once a while. All right, and the quality of the sperm also get affected if if you have the exercise generate a lot of heat. For example, if you have varicose, there's already congestions in the testes, and that will also make the sperm quality lousy. And if you go and do cycling, that will make it worse. So I always advise patients to go swimming because that will calm down, that will keep the testes cool, and the sperm quality may improve. Now, as far as the female is concerned, they must have the exercise sustainable because a lot of women who are overweight, if they exercise and keep their weight to the normal state, then the quality of the ovulation will be better. As far as a couple is concerned, you should have a good lifestyle. That means no late night, cut down smoking, alcohol, okay, regular exercise, and eat healthily, more balanced diet, more vegetables, more fish rather than red meats, all right, and have regular sexual intercourse at the right time, especially during ovulation, because the ovulation window is very narrow. Ovulation in the normal females, say 28 day cycles, the ovulation is only in the middle of the cycles, say between day 12 to day 15, and it lasts only about 24 to 36 hours. The egg will die off after about 36 hours or so. Whereas during the ovulations, the cervical mucus, that's the transparent raw egg white mucus produced by the cervix, can sustain the sperm for about 2 to 3 days. So if you add up all this, it's usually the fertility window may be about 3 to 5 days. For the irregular periods, if the cycles is very, very irregular, it may be due to anovulation. That means the woman may not be ovulating at all. So there may be no mucus at all. So in the polycystic ovarian syndrome, they can produce a lot of mucus, but these mucus are not the fertile mucus. So you have to be careful of that. And they are not ovulating at all. So for the male, there's also a biological clock. The semen analysis always shows that the quality and the quantity of the sperm go down after 35 years old and worse after 40. So I'll encourage the man to be a father before 35. So if your sperm quality is not so good, and if the doctor give you medicine, don't stop and start. You should continue with it for at least 90 days before you check your semen analysis again. Well, this is a myth. People always think that if the sperm quality is not so good, they can store it. But unfortunately, we don't have a sperm bank in the body. All right. So studies have shown that if you store up your semen too long, say after about 14 days or more, then the quality of the sperm usually will be deteriorated. You get quite a lot of old sperms and immature sperms. So it is important to have regular sexual intercourse, say around average about 2 to 3 times a week, and that will improve the fertility potential. Well, studies have shown that if the brief is too tight, it generates heat, and you know that the sperm is afraid of the increased temperature, so that is not so good. So boxer shorts will help if your semen quality is not so good or borderline. Well, before the supplements, actually all the supplements are from the food. The vitamins are important, so that's why balanced diet is very important. From the vegetables, you can get a lot of vitamin C and B, and these are important. Then good oil like omega-3, folic acids, all these are important for the sperm as well. Just to advise those couples, if you get married, don't take fertility for granted. Okay, I'll encourage people to have baby, at least the first baby, as soon as you feel comfortable. I'm Dr. Peter Chu. Thank you for joining me today.